going.
Okay, first I'm going to show you some special tests for the foot and toes, starting with metatarsal joint play. So if I could have you step back. Usually you'll want to do this test for any toe or foot injury. And what you do is put your fingers between the first and second metatarsal head and then shift them forward and back. And then you go to the second and third and fourth, and then you keep going. And this shows any laxity in the foot or if there's pain that could indicate a foot or toe injury. And then the rest of the tests I'm going to do are going to test for a flat foot or pes planus. So the first one is the pes planus supple test. And for that one, I'm going to have her come off the edge of the table. And I'm going to observe her arch without weight bearing. And then I'm going to have her stand on it. And if the arch disappears, it's a positive test for pes planus. And then the second one that also tests for hyperpronation or pes planus is a navicular drop test. So I'm going to mark her navicular process and then observe it. Just sit down on the edge of the table and just have your foot flat on the ground, but don't weight bear. And I'm going to observe her arch and her navicular then, and then I'm going to have her weight bear. And if the navicular drops more than 10 millimeters, it's a positive test. And then the last one is the Feistline test. So for that, I'm going to mark her medial malleolus, her navicular tubercle again, and her first metatarsal head. And then I'm going to have her non-weight bearing. And then I'm going to observe the line, and then I'm going to have her weight bear. And then if that one drops more than 10 millimeters, that's a positive test for flat foot as well. So hers is not positive. And those are my special tests for foot and toes.